doctor, you have malpractice insurance. Yeah, but there's limits to it. If they ask more, they can go after the doctor's assets. I'm concerned about my kids and grandchildren. Who are going to take care of them? Because right now, if you got kids about 20, 21, it doesn't make sense to go into medicine and do what I do. One of my good friends, he's a lawyer, he's one of those 1%er guys, refused to let his kids go into medicine. He's a money guy. He says it doesn't make sense for economic return. What else can we do? The FDA approval process. Drugs are too expensive. Right now it takes anywhere from $500 million to $2 billion to bring a drug to market. Average $800 million. That's expensive. That's ridiculous. Streamline the process. One of the things we can do is, if a drug passes FDA approval, you can't sue the drug company. Now, I'm a small government guy, but we have to have government oversight of this. If the drug company gets caught cheating, somebody goes to jail. And I'm not talking Blago jail, I'm talking real jail. Okay?
1 minute.
All right, next. End of life. We have to change that. There are studies that show all the money you spend in your health care, between 10 and 50%, big range, is spent in the last few months of your life. That's got to change. If a patient comes to me and they have terminal disease, I sit them down. I say to them, I need to know what you want to do at the end of life. I don't need to know now, but what I would like to do is all I can to extend your life, but not prolong your death. Think about that. Extend your life, but not prolong your death. You got to remember, the baby boomers, there's 5 of us for every one of you seniors. But when we get older, there's only 2.5 behind us. For our generation, they won't be able to do for us what we do for you guys. So we have to make a change for our generation. Realistic change. Again, I want the docs to work for the patients, not the government, not the employer. You.
We're joined by another doc, and I'm going to bring him up and let him talk about whatever he wants for a couple minutes. Dr. Dennis Keller.
Relatively casual attire. I'm a critical care doctor and a pulmonologist. I was working and just found out about it. So,
thank you.
Sure, thanks. You know, I had a town hall meeting, or was in a town hall meeting with the chief executive for Advocate. I'm sure you guys know who Advocate is. And for a lot of us doctors, especially for what I do, critical care, pulmonary.
Yes. Go.
Yeah, a lot of what I do is hospital-based medicine.
At the bottom.
At the bottom. And
yeah.
What is it?
Here. This one's better.
Okay.
All yours.
And the conversation that we actually had, or they had with the group of physicians, was how they were rolling out their ACO. And part of Obamacare requires these ACOs, either hospitals or groups of physicians or groups of health systems, to control lives essentially and expenditures of those patients. And part of this ACO is rolling out an MSSP, a Medicare Shared Savings Plan. And what they were essentially asking us to do is to give us the names and addresses of all of our Medicare patients. And I was one of the few people who raised my hand and I asked for clarification. And they are asking for us to give them the names and addresses of our Medicare patients because they can't go to Medicare to get it, but they want to put you into their system. They want to track where you're going and what you're doing, and they want us to be able to push you to their facilities for their testing. This is what they want.
Hold your questions, we'll get to it.
This is phase 1. And as this goes along, the way these healthcare systems actually operate, or a lot of them operate, is that they have large contracts with insurance companies. And what they do is, if they accept you as a physician into, say, Advocate Physician Health Partners, or APP, you can share with their contracts. So if they are contracting with 20 insurance companies on behalf of 600 doctors, obviously the rates are better than me as a solo practitioner. I am a solo practitioner. So in order to continue to participate in these contracts with the healthcare system, you must sign on to their ACO, and you can only sign on to one, and you must participate in this Medicare shared savings program. And to do that, they are asking us, they came short of requiring, you know, we're smart people, we know where this is going. They want the names and addresses of the Medicare patients so they can send you information about having all of your care done in their hospital. And if you had 1 or 2 visits in one of their institutions, one of their hospitals, when you get hospitalized at other places, your information will be shared. So I'm not singling out Advocate by any stretch. I think they're just trying to go as fast as they can to try to implement this, and I'm sure other places around the country are doing it. I'm on staff at 6 hospitals in the area, and again, they seem to be further ahead than anybody else. But this is phase 1. Be prepared.
Our last guest speaker, and I'm going to hold him to a firm 4 minutes because he could go on for 4 hours. Stephen Tucker, in the insurance industry, knows probably more about this law than anybody I've ever met. Steve Tucker. Yep.
He's right, I could go on for an hour.
I won't let him.
He will not let me. I want to just cover 3 basic things today about Obamacare, and I apologize for calling it Obamacare. Actually, I don't, because when the president spends $1.5 million of our taxes to put the term Obamacare on top of Yahoo and Google, I will call it Obamacare, even though it's the Patient Protection and Affordable Care Act. There are 3 things I want to tell you. The number 1 is that the president promised us before this healthcare legislation was passed that the average premium for a family of 4 would be lowered by $2,500. Who remembers him saying that? Okay. In the last 2 years since it's passed, I have seen the highest health insurance rate increases in 17 years of this business. And my clients are calling and screaming and blaming me. Now, when I say high health insurance premiums, I'm not just going to give you the statement. I brought with me premium increase statements for my clients. I brought them in my pocket. I'm going to share with you from the smallest to the highest. This is Blue Cross Blue Shield of Illinois. Okay. The lowest premium increase, 31.35%. Understand that historically, the rate increases for my clients are between 8 and 10%, and that's in a bad year. Let's keep going. 30.17%, 35.63%, and drum roll please, 44.78%. Now, what happens when an insurance company raises the premiums by almost 45%? Do you think that that insured kept his policy? I can tell you that he didn't. And the very first step is to do what? Remove employees from the plan because you can no longer afford it, or terminate the plan altogether. Our friends on the left love to use the narrative that it is the insurance company's evil profits that have caused these health insurance premiums to increase. It is because they are greedy, they want people to quote unquote die in the streets. I'm going to tell you something, and it's not unusual, and it's actually on purpose, that you've not seen a health insurance broker interviewed anywhere, not on Fox News, not on MSNBC, not on any news outlet since this legislation passed. You've heard from doctors who are very knowledgeable, but you've not heard from a health insurance broker. And the reason that that is because the president is a liar. And it pains me to say my president has lied to me. But today and yesterday and about a week, he's been repeating a lie he told in 2008. And that lie was that his mother was denied coverage for cancer under her health insurance plan, when it was proven in 2009 that that was a lie. and that what he was referring to was his mother's disability policy, which has nothing to do with cancer care or with the fact about pre-existing conditions. So, and it's even worse because who acted as her attorney through that whole event with the problems with her disability policy, not her health insurance policy? A young attorney named Barack Obama. So there's no way he couldn't know the truth. And that really points to the character of a man who could tell a lie about a sensitive situation with his mother's health. It really bothers me. But that's not the only isolated issue. The biggest lie the president told was the lie of pre-existing conditions. I want you to know why we have pre-existing conditions and why health insurance companies can deny people and how many of those people they deny. 90% of the American insured in this country are protected under a law that was passed in 1996 called HIPAA law. Who has heard of HIPAA law? The first thing you think about when you think about HIPAA law is what? Privacy. By the way, that's gone with the new accountable care organization. Rich will attest to that. HIPAA privacy is dead. Your medical information will now be shared with HHS to determine whether or not the treatment you're going to get is accountable, affordable, and should be paid for. There's a far more important clause with HIPAA, and that is portability. When they passed 1996 HIPAA portability law, it stated that people who have health insurance on group insurance, not individual, employer-sponsored group insurance, if they maintain that coverage for 18 months and they lose that job, therefore lose that health insurance coverage, when they move to another group health insurance plan, as long as they don't have a lapse between 63 days between this employer plan and this employer plan, this employer plan must provide coverage for all pre-existing conditions with no waiting period, covered from day one. That is why when you leave a former employer, they send you what? A certificate, say it, of creditable coverage. That protects 90% of the American insured. But as usual, the central planning status that reside in Washington, D.C., excluding this one, when they pass legislation, they never do it the right way. And when they passed HIPAA portability law, they either forgot, which I don't believe, or purposely did not extend HIPAA portability protection to individual policy holders. You know, the backbone of this country. Small business owners, usually mom and pops, they don't have enough employees to come to an insurance company and negotiate rates because they have enough lives to spread the risk around. So they buy what's called individual health insurance policies. Individual health insurance policies, thanks to government, thanks to the legislators who wrote federal HIPAA portability, look it up, in '96, they extended no protection for pre-existing to individual policyholders. None. So when you go apply for individual health insurance, yes, you can be denied because you're too heavy, because you have 3 different medications you take, because you have a serious history of mental illness, because you have heart disease in your family. They will, and they can, and it is legal to deny you coverage. Why? Because of the government who wrote that legislation. Do you know how you fix pre-existing conditions? Not 2,700-page healthcare legislation, double-spaced, 960 single-spaced. I'm referring to the PPACA, Obamacare. It takes 1 sentence added to existing federal HIPAA portability law. That sentence says, ready, drum roll please, all individual plans are now protected under existing federal HIPAA portability law. And we have solved pre-existing conditions in this country forever. So, if it only takes 1 sentence to solve pre-existing conditions, what are the other 2,600 pages about? They are about control.
1 minute, Mr. Control.
I want to share one last thing with you. And then we'll go into Q&A. Medicare. Medicare. Oh, do you know why health insurance premiums are so high? Because of government. In 1979, there were 279 mandates placed on health insurance companies to say, if you operate in this state, you want to sell health insurance, guess what? You got to cover cancer. That sounds reasonable, right? Who would like to guess how many mandates we have on health insurance policies now post-Obamacare? 2,100.